Hello everybody, this is James. Today I want to show you a strategy you can use to memorize the etiology of hypercalcemia using a simple mnemonic, MAD-PIG. So let's get started. First, let's take a look at the medical mnemonic. Alright, so malignancy is quite alarming, hence it will be crucial to consider it when evaluating for any hypercalcemia. In multiple myeloma, there is an uncontrolled clonal expansion of plasma cells in the marrow that produces monoclonal immunoglobulins detectable in the serums. However, they are not even competent. What I have here are cancerous plasma cells. These plasma cells can in fact activate osteoclasts. That leads to osteoclastic bone resorptive activity. There's bone demineralization and mobilization of the calciums and phosphates into the blood that increases the calcium blood levels. Due to the osteoclastic activity, there is punched out lytic lesions of the bone, which in fact do not heal, in part to be explained by the fact that the osteoblasts are severely suppressed. In other words, bone formation is inhibited. The acronym that is used to explain the typical features of multiple myeloma is CRAB, with C being elevated calciums, renal failure, anemia, and bone impairment. There may also be a complication such as AL amyloidosis, among many other complications. Squamous cell cancers may produce a parathyroid hormone-related peptide. These peptides may not necessarily be similar in structure to the parathyroid hormones. However, they are able to signal through the same receptors as that of the parathyroid hormones and cause an effect. In other words, the parathyroid gland subsequently releases calciums. Multiple endocrine neoplasia 1 and 2A are rare causes of hypercalcemia. MIN1 is an autosomal dominant condition which is typically described as tumors in the parathyroid gland, pancreas, as well as the pituitary gland. It's often referred to as the 3Ps. MEN2A is a constellation of parathyroid gland tumors, thyroid medullary carcinoma, and pheochromocytoma. The parathyroid gland tumors releases excessive parathyroid hormones that increases the blood calcium levels. Milk alkali syndrome, better termed calcium alkali syndrome, occurs as a result of excessive ingestion of calciums and absorbable alkali. Normally, it is through antacids or over-the-counter vitamin D supplements. During acidosis, the protein binding capacity of calciums with albumins decrease. What I have here is an albumin, and albumin has a protein binding site. These binding sites have an affinity for hydrogen ions as well as the ionized calciums. During acidosis, the hydrogen ions are very much elevated, and so they overwhelm these protein binding sites on albumin, leaving the ionized calciums free and elevated. In adrenal insufficiency, metabolic acidosis may occur. There is also a reduction in aldosterone with its sodium retention capacity. So what I have here is aldosterone that is reduced. That leads to a reduction in sodium water retention. So when there is a reduction in sodium water retention, that is certainly going to lead to a decrease in blood volume. And that would trigger a response from renin in order to regulate aldosterone. So the volume depleted state can actually cause a decline in the GFR and a low filtration rate of calciums. And there is also excessive reabsorption of calciums in the proximal convoluted tubules. Hence, in adrenal insufficiency, there can be hypercalcemia. Drugs such as thiazides works through binding or blocking what is called the sodium chloride cotransporter If this is blocked, then there is an excretion of sodiums. So the excretion of sodiums is in fact exchanged for the reabsorption of calciums, and that leads to calciums entering the cells avidly. It's important to note that one of the clinical manifestations of hypercalcemia is a high blood pressure, and in such situations, thiazide diuretics are not recommended as a drug of choice for management. Lithium may cause a parathyroid hormone-dependent hypercalcemia. Primary hyperparathyroidism, a condition with excessive release of parathyroid hormones from an adenoma of one gland or hyperplasia of all four glands, or rarely from a malignancy. The parathyroid hormone that is released subsequently increases the calcium levels. Paget's disease of the bone. Normally, bone resorption, which is supported by osteoclast, is in balance with bone formation that is supported by osteoblast. Paget's disease has three phases. The first phase comes with more of an osteoclastic activity, and that leads to bone resorption and an increase in the calcium levels. In the second phase of Paget's disease, both osteoclasts and osteoblasts are activated, but it eventually ends up in phase 3 of the disorder where osteoblastic activity is quite immense, and that leads to bone deformations and impingement syndromes. People that consume excessive vitamin D may lead to toxicity from the increased calcium levels that are avidly absorbed from the intestines. Long-term immobilizations from trauma, such as spinal cord injury, may affect bone metabolism through the increase of osteoclastic bone resorption and increased calcium levels. Genetics. Familial hypocalciuric hypercalcemia. This is a disorder or a genetic problem where there is a mutation in the calcium sensing receptors. These are the calcium sensing receptors. That's what we have here. So normally these receptors will bind to calciums and it will trigger a response from the parathyroid gland to increase calciums. But in this case, people are born with a defect, a mutation. Okay, and so what happens is that even though calciums are saturating these receptors, there is no signals, there is no adequate communication or feedback signals from the receptors, that is the incompetent receptors, to the parathyroid gland. Hence, what happens is that the parathyroid gland will rather hyperfunction or increase the calcium levels to boost or to potentiate the calcium receptor response mechanism. This often runs in the family. They do have low calcium levels in the urine, but sometimes high calcium levels in the blood. Granulomatous diseases. Granulomas contain macrophages, giant cells, lymphocytes, and plasma cells. These macrophages may contain 1-alpha hydroxylase that is able to catalyze the synthesis of active vitamin D. And these vitamin D can improve or increase the calcium increase the calcium levels that are being absorbed from the intestines, and hence that can also increase the calcium levels. I hope this was useful. Thank you.